Hey, what's up, family? Welcome back to the channel. Happy Monday to you guys. I hope that you are having a blessed day so far and that the rest of your week goes as accordingly as how you want it to go. But what's happening in a lot of people's lives right now is chaos. And I say that without ease of saying it because it's been a long time since I've heard of this particular disease. And then there's an outbreak from it. And I'm wondering if any of this has to do with all of the new people to our country who maybe aren't immunized as children, because this is something you heard about when you were a child, but kind of fell off. But now it's back in full force, you guys. And it's in multiple states that is happening. Before we go any further, please help this video out by hitting that like button, sharing it out, and definitely leaving comments as to what you think about this particular story. So right now there is an outbreak that is happening. The first state I'm going to talk about is Oregon. Oregon pediatrician warns of nationwide trend of rising measles cases and how it is impacting people and what are the symptoms you need to be looking for. This article is from the week of March 9th. According to the Centers for Disease Control, CDC, 45 measles cases have been reported in 17 states across the U.S. as of this week. 8 of the cases this year were reported in Clark and Waukesha counties in Washington state in January. Health leaders said the nationwide trend is alarming, considering the country saw 58 cases of measles in total last year. One pediatrician in Oregon said that measles cases in the United States are still considered to be relatively rare, but when vaccine rates drop below 95% of the population, that's when clusters of cases start to pop up. How about when you're allowing multiple thousands of people into the country that don't have their vaccines or, related to that? That has nothing to play with it. Why are they being so nonchalant by saying, oh, because people stopped getting vaccinated? No, it's because of the people you're allowing into the country also coming in and bringing whatever they're bringing with them. Measles have distinct symptoms that usually appear within the first few days of infection. White spots can show up in the mouth, and then a rash on the outside of the skin will start around the same time. The rash starts on the head and face, then spreads down the body, usually redder, more noticeable than other viral rashes. If anyone has any of these symptoms, they recommend contacting your medical provider for a screening, especially for children, as 1 in 5 children infected with measles will become hospitalized. And that leads us to the next story, because someone did take their child in, and apparently the child has measles, and now there is a potential outbreak in that state, and people are being warned who might have come in contact with that child. So when you go over to the CDC website, you can see the incline and exactly when it inclined. And it did start going up as the borders started opening up more. So you can see here measles cases in 2024 as of March 7th. 2024, a total of 45 measles cases were reported by 17 jurisdictions: Arizona, California, Florida, Georgia, Illinois, Indiana, Louisiana, Maryland, Michigan, Minnesota, Missouri, New Jersey, New York City, Ohio, Pennsylvania, Virginia, and Washington. And when you go here, you see the graph. Down here you have 2023 at how low it was here. You start to gradually see it go up in 2023. This is January, February, March. By the end of March, it's starting to rise. Now here you have April, May up in here. June, looking pretty good. July, 2023. September, October, look at October and September rising in 2023. Then it kind of went down a little bit in November. Then you have December. You see the steady increase all the way up here. By the end of December, that's where we are. And then over here, we have January of 2024. Numbers starting to go back up. And this is February. Measles cases in 2023 during January 1st through December 31st, 2023, a total of 58 measles cases were reported by 20 jurisdictions: California, Colorado, District of Columbia, Florida, Hawaii, Idaho, Illinois, Kentucky, Maryland, Missouri, New Jersey, New York City, Ohio, Oregon, Pennsylvania, Texas, Utah, Virginia, Washington, and Wisconsin. So what was happening in Oregon? That was the week of March 7th. Now here we are, the week of March 10th. About 300 people in California hospital possibly exposed to measles after child goes for treatment. A California medical facility is trying to contact about 300 people who were possibly exposed to the measles after a child was treated for contagious viral illness at the hospital in Sacramento last week. The child had returned from international travel and was evaluated March 5th at UC Davis Health's emergency department between 12 p.m. and 5 p.m. So if you know somebody that was at that hospital during that time, please let them know about what this is in case they have not been contacted. And noted that they were contacting at least 300 people from that facility who may have been exposed. They said there are no additional potential exposures at UC Davis Medical Center beyond those people who have been identified and contacted. UC Davis has a record of each patient and employee in the emergency department that day, and notifications about potential exposure are being sent through emails and phone calls. The electronic medical records online messaging also is sending urgent alerts out to these potential. They're saying that those who are unvaccinated against measles and or those with unknown vaccination status who were at the UC Davis Medical Center's emergency department during that time are at risk of developing measles between 7 to 21 days of exposure or after exposure. That is not the only place that this child was seen at. The child was first seen at San Joaquin Urgent Care in El Dorado County, where a small number of residents may have been among those exposed. That was indicated in the news release. Measles is a highly contagious disease that can lead to complications and turn deadly, according to the CDC. Measles often begin with a mild to moderate fever, along with a cough, runny nose, and red, watery eyes. Some patients also report diarrhea, nausea, vomiting. Generally, a red, blotchy rash appears first on the face and rapidly spreads to the chest, back, thighs, and lower body, meaning your feet. It's also on the palms of your hands as well, and it starts in your mouth as white bumps. It is spread through the respiratory route and can live in the air for up to an hour where an infectious person coughed or sneezed. Rising cases have experts very, very concerned. So y'all let me know what you think down in the comments below. Do you think that this has anything to do with the borders being open, or just a lack of, vaccinations? Because they're trying to push the vaccinations. We're going to hear about more diseases that we thought were long gone are going to be back. Protect yourself.
Never up, never down.